Good morning. Today's case is an iTero scan review of a fairly complicated case. We've got a patient here that presented for a comprehensive examination and wanted to know what was going on. So as part of my protocol, I always take a full mouth iTero scan. Now you can see this scan isn't ideal, and certainly we could have spent a few more minutes improving the quality of the scan, but for patient education purposes, this scan worked just fine. So at first glance, you can see some significant issues, not the least of which, is a couple of missing crowns there on the upper left with some recurrent decay. She's missing a tooth on the lower right, as well as, quite a bit of stain, possibly decay in certain areas, as well as a large cavity on this lower right tooth. So let's take a look at the lower arch first. You can see a fairly significant cavity on the distal occlusal of tooth number 30, and if we go into the viewer here, let's get an actual view of this. You can see it's a pretty substantial cavity here. My conversation with the patient is I'm not sure if the tooth is fixable. At a minimum, it's going to need a root canal and a crown if we're going to even try to fix it. But I believe this tooth will probably be fixable. Now the question mark is how deep down to the bone or in relation to the bone is that tooth decay. A lot of times the cavity will go subgingivally and we can still save the tooth, but once it reaches the level of the bone, unless we want to talk about some sort of crown lengthening procedure, in certain situations the tooth is no longer restorable. Now in this situation where there's no distal tooth, sometimes what I've done in the past is if we get to that point where the decay matches the bone level or is slightly subcrestal to the bone, then I will use my handpiece, the high-speed handpiece, and actually adjust the height of the bone and the tissue down there. And I've had very good success. Now this is definitely something we want to do in communication with the patient so they're aware of what's happening as we're doing it, to make sure that they're aware of the risks and problems and associated consequences. But in this situation, if we contour the bone and the gum tissue with no adjacent tooth, the success rate's very good in my experience. So scanning over to the lower left, we can see we have a broken tooth here. Kind of a similar issue to the lower right. She's got an amalgam filling here with multiple areas that have come out. Let me cycle this so I can get the viewer back up here. So in this situation, essentially I had the same conversation with the patient. This tooth is probably still fixable. Looks really fixable, to be honest. But I'm going to treatment plan a root canal and a crown for this. There's a good chance as we get into this procedure, the tooth will not need a root canal, but I usually lead with this will need a root canal and a crown. And then at the end of the preparation for the crown, removal of the decay, and the confirmation of whether or not we actually need it, that allows the dentist to be a hero by saying, hey, we don't need the root canal. Now, in some situations, the root canal is still advised based on the depth of the decay, but in this scenario, I would lead again with, we're going to need a root canal and a crown. And then if we get to the point where we don't need it, we just don't need it. And we get to save the patient that money, and they're always grateful for that. So let's take a look at the upper arch. Kind of a similar set of challenges here. The patient has two crowns that have been missing for an unknown period of time, several years it looks like in this situation. Now, although on the surface these teeth may be fixable, or it appears that they may be fixable, sometimes a tooth dentin that has been soaked in saliva for years at a time may render the tooth to the point where it's just so soft we can't really do much to save it. So in this situation, you have to be very cautious with what you promise or commit to with the patient. We can't just tell the patient, yep, a crown is all it needs, or crown and core buildup, or crown and core buildup and root canal. A lot of times in this scenario, we have to actually tiptoe and be very careful with our words from the standpoint of telling a patient, for instance, it looks like the tooth is probably fixable, but in other situations that I've encountered or other patients of mine have found that a tooth like this that's been missing a crown for some period of time may not be fixable even though it appears like it is. And the reason for that is the saliva tends to soften the tooth structure over time, and we may get to a point where there's just not enough healthy tooth left to save. So best case scenario, I'm going to treatment plan a root canal and a crown for you, patient. And we'll hope for the best when we get in there. There is some chance we may not be able to fix it, and if we can't fix it, we'll take a step back, we'll talk about options, and kind of go from there. How does that sound to you? Presenting that with confidence, even though we don't know which way the tooth is going to go, presenting the treatment plan with confidence is really important. That way the patient feels like you know what you're doing, and also knows that you are interested in what's in their best interest. rather than, yeah, I'm not sure, we'll just have to see and give it a try, and being very careful with, displaying, that you should know what you're talking about and know what you're doing. So root canal at crown is what it needs if it's going to be fixable. However, we may get to the point where we discover there's not enough healthy tooth structure, and then we can talk about it at that point. So even though I'm unsure, I can still show confidence that we have a good solution or have a series of options from which to pick. So in this situation, we did actually complete 2 crowns on these teeth, and they did not need root canals, either one of them. The long-term outcome, in my opinion, is good. I think both of these teeth, from a long-term standpoint, will be very, very serviceable to this patient. Now, she does have some periodontal disease, and so she'll be undergoing scaling and root planing therapy along with a 3-month accelerated recare to help manage the periodontal maintenance. You can see she's got some abfractions on multiple teeth, so we discussed her clenching and grinding and the alignment of her teeth, and discussed some Invisalign potential to realign the teeth, give her a more stable bite. Also talked about some of the discoloration, which was a cosmetic concern to her. So from the standpoint of this particular scan review, ultimately this patient stands in need of quite a bit of dental care. The good news is it's all pretty routine stuff. These two, as I said, were where we started. And so we'll get to a point at some point where we'll work through the lower right and see what we can do to get things moving for her. So thanks for watching. Appreciate it.